I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of IDD Health Matters. I have a great guest today, Jackie Kancir. Welcome, Jackie.
Thank you. Thank you for having me.
So, Jackie, tell us a little bit about what you do in this field.
Well, I am a patient advocate and a policy advocate. I have been most of my life, honestly. I was kind of born into this. I'm third generation. But I'm here this weekend for the National Council on Severe Autism as their policy director.
Okay. So what are some of the policies that you're currently working on in that organization?
Well, we have a lot of work that we're doing on the congressional front regarding empty waivers, housing, really quite a bit. But my intersection with AADMD recently came into play regarding our push for the Autism CARES Act to be amended to include profound autism, as well as some of the clinical work that AADMD is doing with integration very much interests me.
Great. And for everybody out there, we are coming to you from the AADMD conference, the American Academy of Developmental Medicine and Dentistry conference in Chicago. So
yes.
Now, are you speaking at the conference?
No. Steve invited me in. This was really last minute. I didn't even know about the conference until about a month ago. And Steve invited me to come out. So it's been really amazing, just all of the conversations I've been able to have, and I think that it's going to lead to bigger conversations in the coming weeks, so that's really exciting.
That's one of the great things that happens at these conferences is the networking, the people we get to meet, the stories we get to hear, and it does move things forward.
Yes.
Sometimes maybe not as fast as we'd like, but we've got to work right towards things.
Right.
Yeah. So tell me about your own life and your family and you know, how this all relates to what you do.
So I'm mom to Jaden, and she is about to be 21. We're about to hit that cliff, so that's quite a present moment. But she has profound autism, Lennox-Gastaut syndrome. Okay. So it's been nice seeing the different providers here for neurology, and then also she has a ultra rare genetic condition called SYNGAP1. And so my entire life is pretty much surrounded around advocating for really marginalized populations within the disability community.
Yeah, and you mentioned something about falling off the cliff. Yeah. I mean, we know what that means, but let's talk about just a second. Describe what that means. Well,
what that means is, you know, she deals with her particular population deals with an enhanced level of disparity anyways, but up until now, I've somewhat been able to have a little bit of a foot in the door to get her some of the services she needed. They're utilizing EPSDT, as well as through the educational system. And she has obviously a really solid IEP and related services. But she has one more year left of school, so once she turns 21, you know, next year, that's it. And then she'll be home an additional 42 hours a week. But yet, the day she turns 21, she loses EPSDT. Right. And now we're going to be confined to the caps of the MCO of 35 hours a week. And, you know, plus all the different changes in healthcare, going from complex care pediatrics to who is going to be the keystone of this complex case with 16 specialists as an adult.
Yep, you know? And that's the transition component that is quite challenging.
Yes.
You know, we're set up as a society and a medical society to really, you know, younger people, children have pretty good access to developmental pediatricians and their supports and services and funding sources. But once you hit the adult level, that's the cliff we talk about. Things change.
Yes.
Funding sources change, opportunities change, and the challenge in finding an adult healthcare provider who understands this field. And that's why, you know, I preach all the time about education of healthcare providers needs to be a part of every curriculum
Absolutely.
Yeah.
We've been very fortunate in Tennessee with Matt Holder opening
Yep.
Kramer Davis.
Yep.
And that has so invigorated the community to see this integrated system that he's built that is specialized to our population. And it really came at the nick of time for us. As I said, we're about to transition out, and we had no idea where we were going to go for her adult care, but Kramer Davis is going to take that over.
So Dr. Matt Holder, he's been a guest as well, and we're friends, and I went and toured the clinic, and they have created an amazing clinic, Kramer Davis Health. A little plug for them, I have to say.
Yeah, absolutely.
They're doing great work for people
Really.
who need it, for sure.
Really,
So,
yes.
Yeah. So what are some of the, what I'd say, kind of exciting things that you work on a daily basis, or what's your passion about? What's your favorite thing to work on?
Yeah, my passion, I guess, is kind of changing the whole system. But
that's simple. Just
putting people together. The collaborations, because it is complex. So it does involve policymakers. It involves clinicians and parents, and of course advocates themselves, the self-advocates. And so it really is a lot about networking and putting people together. But for example, I'm very much a solutions person. It's easy to see all the problems that we have, but I look at it kind of like a puzzle, and how do we complete it? So one example is when we had negative experiences at a hospital, we developed hospital protocols for that. But that was 2 years ago, and it still remains optional. So some hospitals have opted in. The National Center for Start Services has adopted it. It's part of the Vanderbilt Toolkit.
Great.
But it's not mandatory. And for me, I feel that people with IDD have a right to safety and to access.
Absolutely.
So that's currently one of my projects, is expanding on the work we already started with those protocols. How do we make that part mandatory? How do we add in treatment algorithms, the Fatal Five, and just make sure that people with IDD are actually getting the safe care that they need?
Well, it's a very important thing to be passionate about and to be working on, for sure. I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. Jackie, one of the things that I like to do is something I call 3 and 3. It's 3 little tips, points, words of wisdom that you'd like everybody to know that you think can positively influence this field.
Yeah. Well, I don't know how much wisdom I have left, but I would say, integration is the future. We really need to move beyond the bifurcated systems that we have. It's fractured. I would argue that it doesn't work for anyone in the general population, but especially for this population. Yep. So integration one, biopsychosocial approach that we see a lot of diagnostic overshadowing that causes a lot of negative health outcomes. So if somebody comes in and they are struggling with a behavior crisis, it's not necessarily psychiatric.
Right.
Don't pump them full of Haldol. Don't put them in mechanical restraints. They may have a UTI. They may have dental pain.
Exactly.
And we need to explore these things and listen to the caregiver about, is this a shift in baseline? That's really the main question. Mm-hmm. And then 3, the potential here. My daughter is, we moved out to a homestead. I bought her homestead last year, and she has chickens and bunnies, and I'm originally a city girl, so I knew nothing about this. But she has learned so much being on the farm with the animals, and it's adding on to fine motor skills. It's giving her a sense of purpose. And so I would say just think outside the box. It might not be, a job at the local convenience store, but this here is something that she is really passionate about, and that's what matters.
That is what matters.
Yeah.
It's making sure that we take into account what people want for their own lives,
right,
and not just what everybody else thinks.
Exactly.
They should be
exactly
involved in. Those are great things, great points for everyone to think about and to consider. I really thank you for taking a few minutes to talk with me today.
Absolutely. I
but
appreciate
also
it.
for the incredible work that you're doing and the advocacy and everything that you do. So
I
thanks
appreciate
for being
it.
here.
Thank you very much. Thank you.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.